And they were even collecting money from patients who, were able to contact the practice from home, where the doctor's sitting at home, she's still able to spend time with family, but she's also still running operations for the dental practice.
This is Growth in Dentistry, a dental intelligence podcast where we ask the question, what does growth in dentistry look like to you? I'm Katie Polson, a dental hygienist and your host. Welcome to another episode of Growth in Dentistry. We are continuing our conversation on the staffing shortage. And before we get started, I wanted to invite you to join our Facebook Dental Intelligence community. Also, we want to hear from you. Like, subscribe, rate, and review. That would be so great. If you have any questions or comments, go to our podcast page at dentalintel.com and record one. They will be featured on an upcoming episode. Now, on to our show today. We are talking about staffing, fixing your staff pain with the power of automation. And with me to discuss that is Steve Jensen, our VP of Business Development. Welcome, Steve.
Thank you. I'm excited to be here.
And Steve is introducing our great guest and also coworker,
Kelsey.
Yeah.
Kelsey Masterson. And we are lucky to have Kelsey. Kelsey has had years and years and years of experience working in dental. She has worked in office management. She has worked in clinical dentistry for over 10 years, and now is working on the software side of things with Modneto. And we are thrilled to gain her perspective from that clinical side, the office management side, and now from a software side of things. Now, there are a lot of things going on in the industry right now. And obviously, like Katie said, we're going to talk specifically about staffing. And now when we talk about working with teams, there's a lot of creative things we can do with software. And so I think that Kelsey's the perfect person to have to help bridge that gap today.
Yeah. So good. So glad. Welcome. Yeah. So for those of you that may or may not know, Dental Intelligence acquired Modneto. So that's why she's our coworker. I don't know if we said that or not, but we probably should. We're just so thrilled to have Modneto and the software and the team. It's just uplifted our entire product and also our team base. So we're so grateful to have them. We want to talk about automation, and people probably think, what does that have to do with staffing? But there are a lot of people suffering out there that just cannot find staff. And one of the ways that we as a software company can alleviate that is by helping them automate some of the things that they might not necessarily need to do or manually. And it saves them time. So a lot of times when we talk about AI, we talk about people being worried about turning their jobs over to AI. So we're going to get into that too. But first of all, how can automating and using software decrease team stress in an office? I know that you've worked with a lot of offices. So how have you seen that?
So personally, from experience, we have always relied on some form of automation to help assist our front office team and our clinical team really streamline those smaller, tedious tasks that really take away from your patient experience. So as we're sending confirmation and reminder text messages and emails, it makes it much simpler for a patient to be able to respond with a simple text message or an auto response on an Apple Watch, any kind of smartwatch or tablet or phone, rather than having to pick up the phone, dial in, step away from work just to get that confirmation successfully turned over to their dental practice. So with Modneto and the ability to also streamline things like new patient forms, we're able to then add patient information directly back into the practice management software. We're scanning those documents directly. We're digitally transferring that data directly back into the patient chart, which is really helping alleviate the need to manually enter data, scan, shred, etc. Or now you have patients whose paperwork is done prior to walking in the door, and they're able to start their experience right off the get-go.
Yeah. And I noticed when you were talking about that, what does that do for the team? I mean, it allows them to do the things that they want to do, which is patient care.
Exactly.
Right? Yeah.
Yep. And especially in a post-COVID environment, really, truly establishing those lifelong relationships with patients, establishing trust, establishing compassion. Those are all things that are going to create an ideal patient relationship and an ideal patient experience from a new patient to existing to someone who's been with the practice for 30 years. So, really being able to give the team back what they've really been striving to hold on to during this kind of an environment where you're not able to see smiles through masks. And, it really, truly puts that sparkle back into their job and gives them the ability to enjoy what they're doing.
Yeah, that's so great. anything else you have to add?
No, that's great. I mean, well, I do have something. I was just picturing, in the front office, you are managing so many different things. And I think the status quo right now across dentistry, and I'm picturing actually going into practice, is when you walk in, either two things are going to happen. Number one, the front office is going to hand you like a paper clip or what's it called? Not a paper, a clipboard.
Yeah.
That's the one. A clipboard. And I'm going to like sit down and start filling stuff out. And if I've got questions, I'm going to interrupt whatever they're working on to ask them as I fill out this piece of paper. I'm going to hand it back, and then they have to transcribe all of that into the practice management software. Or if they're like more advanced, then maybe they're giving something like an iPad to me and I'm filling out. But even then, most of the time they're still having to like copy and paste. And what I love that Kelsey's identifying is, look, there are some clever ways that we can improve the experience for the front office team. Especially imagine if we lose a team member. I think the habit of a doctor or an owner would be to just ask everyone to do more, which you're going to have to until you find someone. So any of these clever places where we can reduce some of that friction and reduce some of that workload for our team is going to be like wildly helpful. So even just the clever thing that you mentioned, like the forms writing straight back in, is such a helpful tool in the current current COVID world, not post COVID quite yet.
Yeah.
Hopefully soon, but not yet.
Yeah, and I feel like it also takes out the monotony of the
Mhm.
day. I've worked front office before when I was going through hygiene school over to reception, and it gets super busy really quick, and it's monotonous. It's just saving, scanning, and blah blah. It's just the same thing over and over and over and over and over again. So I think definitely. So I want to spend a little bit more time on this next question, which is, what do you say to those individuals who may have been worried about turning over tasks to AI, to automation, to software? What would you say to them?
I mean, I think looking at it from a perspective of how can this technology help you succeed in your practice? How can this technology help grow your business, grow your patient base and the, recurring patients that are coming back in, rather than looking at it as, yes, I sit here and make, 15 confirmation calls per day. What can you do at the time that you're normally spending on those confirmation calls that now you can give back to the patients that are in person, or something that you can do to help teammates? And at the end of the day, everyone's going to be able to have, the same type of experience, because your clinical staff is streamlining their tasks with digital consent forms and post-ops. And now you have your front office also streamlining things like their new patient forms or updating health histories. So everyone wins at the end of the day when you have something that's assisting your team without needing additional bodies in the practice.
Yeah, that's good. I think I've heard that worry as well from people. I don't know if you have, Steve, people being worried that they're going to be softwared out of a job, right?
Right.
But dentistry is a people profession, which is probably why a lot of people chose to go into dentistry, is because they want to be with people. And so I really feel like software and automation allows you to do that. So that's great insight. The other thing that I wanted to discuss was, what other success stories? I mean, you've worked with a lot of practices now using and with the software. What success stories can you share with us and the people listening of practices who've automated with a Modneto and what it looks like in their practice?
So one of my favorite stories was actually at the very beginning of when COVID hit last March. And I had a dentist who was a little panicked. Everyone was a little worried about coming back into the practice, being able to see patients and screening for remote consultations or emergency appointments virtually. So being able to onboard them during COVID, they were able to take control remotely of the patients that were calling the practice, having their phones forwarded to their cell phone. And they were even collecting money from patients who, were able to contact the practice from home, where the doctor's sitting at home. She's still able to spend time with family, but she's also still running operations for the dental practice. So the ability to send those patient forms to screen for health histories, to screen for previous records, and then meet the patient in person for an emergency consultation was, a huge benefit for doctors who were trying to keep the business open and still be able to see patients to alleviate pain and those emergency situations where they wouldn't otherwise be able to be treated, and, still be able to stay out of the practice and not have a full staff, working together in a COVID environment. So I really think that was a very strong message from that doctor back. She would send us thank yous through our support chat. She would send us emails, text messages, she'd call. And every time she would make contact with a patient or be able to coordinate a virtual consult, she would just call and say, I cannot believe how easy it was for me to be able to log in, having no experience with these softwares, and really be able to connect with my patients and give them a good experience without having technology fail or without having to loop 3 other staff members in just to meet one patient at the office to make sure that they get the care that they need. So having the ability, to connect with those patients virtually, remotely, and stay safe at the same time is obviously a huge benefit for doctors. In terms of automating, I know there's a lot that can be automated within Modneto for things like voicemail drops. Those are huge for doctors to be able to still connect with patients post-appointment.
I'm going to stop you really quick, Kelsey.
Yeah.
I think for some listeners, they might not even know what a voicemail
Yeah.
drop is. I think if you let them know, like, hey, this is this clever thing, because it is really clever that we've created.
Yeah.
And with some of the ways that you can use it. So yeah, share with them first what's
Sure.
a voicemail drop, and then let's talk automation, because it really is so cool.
Yeah, voicemail drops are actually my personal favorite feature of Modneto. The reason being, I've worked for plenty of doctors who at the end of the day either take a copy of the schedule home, or they'll jot down phone numbers to go back into their office and make those personal post-op calls to check in on patients they saw throughout the day. With voicemail drops, either the doctor, hygienist, any provider within the practice can actually record a generic message. It's an audio message that's uploaded to the Modneto dashboard. And what we do is we facilitate a missed call to the patient's phone, and it drops that voicemail directly in their voicemail box. So they see the missed call, they immediately have a voicemail, and on the other end is Dr. Smith checking in to see how they're feeling after their procedure today. Meanwhile, it takes 2 button clicks for the doctor to be able to send those out. They can also outsource those either to the treating assistant, front office team, and they can be sent individually or in bulk. But it's a great way to contact patients. Again, you can use it for other things, obviously, other than post-ops, but it really does keep that communication open for patients and the practice, where you're not having to spend, an hour to 2 hours making those calls every single day.
Yeah. And I mean, I realize that it's a double-edged sword, this voicemail drop, because you want the message to be personal, but in all reality, oftentimes it's so draining at the end of the day to call a patient, because it is like it's open season. Sometimes you don't know what you're going to get. You don't know what you're going to get on the other end of that phone call. And so if they call you back, then you know that you have a problem. They have a problem. But if not, it's just nice for them to know that you've thought about them. So
right,
for sure, I love voicemail drops. I love the idea of it. It's such a great feature. Well, this has been so great, and I hope that people understand a little bit more about just automation in general and how it can reduce your staffing issues and make you feel like you're a little bit more in control, even if you are down, one team member in the front, that it can give you a little bit more control. Also, the one thing that I was going to bring up is that as I was working through the start of this pandemic, I thought, like everybody else has a job that they can do from home. I don't. I'm in people's mouths, right? But by doing some of this automation, it really does allow you to work, in quotes, from home a little bit. Some of the staff can work from home. You're able to do a lot of stuff from home, which is pretty revolutionary for the field of dentistry. So
absolutely,
that's really great. Yeah. Anything else? I think we got it covered. It's such a great topic. Thank you so much for being here, Kelsey. We appreciate it.
Thank you for having me.
Yeah, this has been Growth in Dentistry, a Dental Intelligence podcast. Special thanks to our guest, Kelsey Masterson. You can find her at kelsey@modneto.io. That link will be in our show notes. You can also find that link and other great information by visiting our webpage at dentalintel.com. Thank you to Stephen Jensen for joining me today. And thanks to our marketing department for all their work on this podcast. I'm Katie Polson. Keep growing.